lecture, a fundamental understanding of the core principles and approaches utilized by epidemiologists shall be examined. These are critical to the study and practice of public health in Canada and abroad. Now, let's begin our learning journey.
So what is health surveillance? Well, health surveillance involves the tracking and forecasting of any health event or health determinant through the continuous collection of high-quality data, the integration, analysis, and interpretation of those data into reports, advisories, alerts, and warnings, and the dissemination to those who need to know. This is an integral part of public health and epidemiology. So the information gathered can be utilized to estimate the magnitude of the disease or health conditions in various geographical regions. We can also better understand the natural history of a disease or detect potential emerging epidemics and pandemics that may be developing. I put up a photo here of a mosquito, and in fact, the mosquito is the world's deadliest animal that kills more than 7,000 people every year and account for approximately 17% of the estimated global burden of infectious diseases. So it's not the shark, it's not a poisonous snake, etc. The most dangerous creature. It is in fact the mosquito. There are an estimated 110 trillion mosquitoes stalking the earth right now at this very moment. Tracking of communicable diseases globally. While certain communicable diseases are also tracked globally and reported to the International Health Regulation branch of the WHO, the World Health Organization. So everything from SARS, of course, hepatitis A and B, HIV, AIDS, these are examples of diseases that would be reported to the IHR branch of the WHO. The emergence of avian flu, severe acute respiratory syndrome, West Nile virus, Zika virus, and COVID-19 quite recently have highlighted the critical public health need for tracking and surveillance of diseases both nationally and internationally. Indeed, one may argue that communicable diseases do not respect international borders. It is easily transmitted across borders due to trade, commerce, flights from aircraft, etc. Hence, we need to think of their transmission from a possible global context as well. Determining the cause or etiology of communicable diseases. So one of the major functions in epidemiological investigations for public health entails the study of communicable, or also known as infectious diseases, if you wish, in relation to their cause or etiology. Now I put up here a photo of a black-legged tick. These are very prominent throughout the world, in Asia and in North America, in the northern parts of the United States, in Canada, Ontario, Quebec, and in Europe as well. Well, Lyme disease is actually caused by bacterium Borrelia here, and it is transmitted by this black-legged tick. Here we see the epidemiological triangle of communicable disease. So in order to ascertain the root cause of a communicable disease or altered states of health, the epidemiologist must first carefully consider the four multifactorial elements: the host, agent, environment, and time. And of course, we use this triangle for communicable disease in terms of infection control. If we want to somehow stop the chain of infection, there are various things that we can do. For example, in the host, we could try to immunize the host against various vaccine-preventable diseases. We could also tell them, to the importance of social distancing and wearing a mask in the case of COVID-19. We can also affect the agent through the administration of antivirals or antibacterial agents, or things that are in our environment, such as using disinfectants. So what is the host? Well, the host refers to the animal or human on which the agent acts to create disease or altered states of health and well-being. So what happens here is the host actually offers subsistence or a home for the pathogen to become established, although the host may or may not always develop the particular disease. So here I put an example of Middle East respiratory syndrome, MERS, which is a viral respiratory disease caused by a novel coronavirus known as MERS Corona V that was first identified in Saudi Arabia in the year 2012. And there's other coronaviruses, of course, COVID-19 and SARS are other recent examples that we've experienced globally. Well, the current evidence suggests that dromedary camels are a major reservoir host for MERS coronavirus infections in humans. Although the camels are infected, usually exhibit only very mild symptoms themselves. Approximately 35% of human cases that actually contract MERS infections have actually died. So the level of immunity, one's genetic makeup, your age, your level of exposure, and or overall health and well-being can determine the extent of the effects of the pathogen on the host. So here I put a photo of cellulitis of a left leg, and this is sort of a personal story that I would like to share with you guys. So cellulitis, first to begin with, is a very common, potentially serious bacterial skin infection. And if it's left untreated, the infection can spread to your lymph nodes and bloodstream and rapidly become life-threatening. Well, this photo is actually a picture of my left leg. I was out in Australia visiting the Great Barrier Reefs, doing some diving there, and I cut my left leg either on some barnacles or on some ships, some old sunken ships that I was investigating while diving. And just in a matter of a day or so, it became very red, very infected. I could not stand. My leg swelled up to approximately twice its size. I had to be put into the hospital. I was there for a period of 10 days. I had to receive very aggressive intravenous antibiotics. And this is when this picture here is actually of a later picture when the infection actually has calmed down a little bit, but it actually spread into my groin area. And a surgeon came in and told me that they may have to do a surgical intervention, which in this case refers to actually cutting away infected tissue or muscle, if you wish, and or amputation if they could not stop the infection from spreading further with antibiotics. Luckily, I did recover, but I needed physiotherapy afterwards as well and massage therapy, which increases blood circulation to the area upon discharge. So what is the agent? Well, the agent is defined as a toxic substance. It could be a microorganism, or it may also be an environmental factor, such as radiation, or a specific lifestyle, such as which may be present or absent for the problem to occur. So here you see a microorganism example as an agent, and here is a tapeworm. Tapeworm infections are caused by ingesting food or water contaminated with tapeworm eggs or larvae. Adult tapeworms can measure more than 25 meters, and it very astonishes me that they can survive for as long as 30 years in a host. Analytical epidemiology that we covered in part 1 of this lecture if you can recall, seeks to define and establish the link between the agent and the communicable disease or altered state of health in order to determine causality. Disease agents or etiological factors can be classified into the following 4 specific categories: nutritive, chemical, physical, and infectious agents. Now, chemical agents could be anything from dioxins in the environment, PCBs. Physical agents could be noise, heat, radiation, and of course, infectious agents could be a variety of viruses, bacteria, or prions in the environment. I put up here a photo of a vitamin C supplement bottle. We know that a lack of vitamin C or ascorbic acid has been linked to the development of scurvy, whereas excessive consumption of supplements can result in the development of renal calculi, or in other words, kidney stones, because it actually, if you're taking too much supplements, which some people do, especially in the winter months, they believe it starves off a cold and so forth. It makes your urine very acidic, and of course, it increases your risk for developing these renal calculi. So this is a really good example of too much of a substance, what it can result in negative health effects, or not having enough of a substance, resulting in the development of scurvy here. What is the environment? Well, the environment in the original epidemiological triangle that I just showed you consists of factors outside of the host that are associated with the development of a disease, disorder, or injury. And here you see a public health notice posted in New Zealand. I snapped this picture, warning individuals not to collect shellfish because of a recent poison spill and contamination. Climate and geographical location example. Well, epidemiologists must consider the physical environment in which the agent and host resides, because certain diseases are obviously more prevalent in particular climates or geographical locations. Okay, so we know in warmer locations, in the tropics, for example, scarlet fever, malaria, dengue fever, yellow fever, and cholera are rampant. Here you see an example of a public health notice that I snapped while I was in Hong Kong. It says, be vigilant against scarlet fever. It's written both in Cantonese and English. And we know that scarlet fever is actually caused by a bacteria called Group A streptococcus, or Group A strep. That is the actual cause of that. We also have the time component for the epidemiological triangle, and the time or temporal component is also critical in determining the natural evolution or course of a disease. The time component helps to establish the required incubation periods for communicable agents, the life expectancy of the host or pathogen, and the duration and course of the disease or altered health condition. Here we see the 4 common stages for the natural history of disease, and of course it starts off with the stage of susceptibility. Let's say, for example, an individual does not have a protected sex and contracts the HIV virus within them. Number 2 is a stage of pre-symptomatic diseases. Many individuals with HIV remain asymptomatic until several months afterwards. In fact, it may not even be detected on a blood test for up to 6 months, for example, in some locations. And the symptoms might be very mild, sort of flu-like in nature. Then we have stage 3, stage of clinical disease, where it becomes full-blown HIV/AIDS or autoimmune deficiency syndrome develops, and it's keeping the same theme. And here you have a stage of recovery, disability, or death that may occur as stage 4. Some of the leading causes of morbidity and mortality. Although infectious diseases are still present and major global concerns. Of course, we have most recently COVID-19, various STIs, as my previous example, and of course tuberculosis. They are no longer the leading cause of mortality and morbidity in developed and industrial nations such as Canada, the US, the UK, Australia, and New Zealand. And they have been replaced by so-called non-communicable diseases. Here we have the revised and updated epidemiological triangle that seeks to address that change in disease patterns from major communicable diseases to non-communicable diseases, sort of dominating now. So this updated epidemiological triangle is more comprehensive in nature compared to the traditional epidemiological triangle for infectious disease, because it recognizes now that alterations to health and well-being are often fluid in nature and more complex in reference to the environment, the determinants of health, and or associated risk factors, which can be both modifiable, and modifiable risk factor examples might be inactivity or sedentary lifestyle, smoking, diet high in saturated fats, or non-modifiable in nature, such as genetic predisposition or sex. So here you see the revised and updated epidemiological triangle. So this updated and expanded epidemiological triangle takes into consideration all facets of the original epidemiological triangle that was developed for infectious or communicable diseases, but it also takes into account the chronic nature of non-communicable diseases, conditions, disorders, defects, injuries, and associated morbidities and mortalities across the lifespan. The time component of this revised and updated epidemiological triangle recognizes that non-communicable diseases, or NCDs, often take several years or even decades to clinically manifest themselves. And some examples of that might be heart disease, stroke, type 2 diabetes, various forms of arthritis, Alzheimer's disease and other forms of dementia, and of course, cancer. Hypertension has been called the silent killer because people do not realize they have high blood pressure or high hypertension. Can only be determined if someone actually takes a blood pressure reading. And we know that hypertension has been linked to the development of cardiovascular disease and kidney failure. Social determinants of health are defined as the structural determinants and conditions of daily life responsible for a major part of health inequities between and within countries. They include the distribution of power, income, goods, and services, and the circumstances of people's lives, such as their access to healthcare, schools, and education, their conditions of work and leisure, and the state of their housing and environment. The term social determinants is thus shorthand for the social, political, economic, environmental, and cultural factors that greatly affect health status. And this definition is from the World Health Organization. Evolution of the term environment. Well, the term environment, if you can recall in the original epidemiological triangle, was limited to the physical conditions and surroundings that were external to humans or animals that cause or allow for the transmission of infectious diseases. An example here we put up was, of course, contaminated water is estimated to cause almost 500,000 deaths related to diarrhea each year. Diarrhea can be a life-threatening condition. You lose various electrolytes, and of course, this can be life compromising. Contaminated water can transmit a variety of diseases, cholera, dysentery, typhoid, and polio, to name but a few. And here's a picture of a raw sewage that I snapped being discharged directly into a creek. The evolution of the term environment, well, this updated epidemiological triangle expands on this condition and recognizes the impact of these various aforementioned political, social, and cultural environments on states of health and well-being. So examples might be children living in an abused home, war. Of course, it's very difficult to have health when someone is shooting at you or bombing you and destroying infrastructures and so forth. And of course, poverty. All healthcare professionals are legally required to report all suspected cases of child abuse in Canada, the US, and the UK. Individuals, groups, communities, and entire population. So lastly, the individual host shown in the original epidemiological triangle for communicable disease has been included to include aggregates such as groups, communities, or entire populations, which is in concert with the primary healthcare approach. Hence, the process of public health promotion and prevention embrace actions directed at strengthening the skills and capabilities of both individuals and aggregates across the lifespan. Next, we're going to talk about some very common epidemiological measures, and I've chosen these based on ones that I believe most often appear in government reports, from Health Canada, for example, from the CDC, from the World Health Organization, and in published journals. So here we have a variety of health status indicators, and they are employed to provide a snapshot of the major diseases, conditions, altered states of health, disabilities and injuries in a defined population or community. So it really has that sort of community and population focus. So let's begin with examining morbidity rates. So morbidity is defined as the incidence of non-fatal cases, or ones who did not die, in other words, of a disease or health condition in the total population at risk during a specified time period. And you will see that time plays a critical element in a lot of these formulas that I will be putting up. So the morbidity rate is simply new non-fatal cases divided by the total population at risk. Very, very easy to calculate. What is the mortality rate? Well, mortality is defined as the incidence of death in a defined population during a specified period of time, and it is calculated by dividing the total number of fatalities or deaths during that time period by the total population. And it can be expressed in a variety of ways, such as the crude mortality rate, the infant or maternal mortality rates, age-specific for specific cohorts, or cause-specific, for example, cancer, heart disease, those related to suicide or motor vehicle accidents. Over here you see a picture which I snapped involving childbed fever. This is from Vienna. Some coffins. You'll see one of a mother and a couple children coffins there. Childbed fever, we know today, is due to a streptococcal infection, and it's introduced into the vagina by a woman's birth attendants. It was a common cause of infant and maternal death prior to the 19th century. So what we had, really the champion of hand washing, began with Ignaz Semmelweis. And Semmelweis was a Hungarian-born obstetrician who went to Vienna. And what he observed is different units we're having different births, those delivered by obstetricians and medical students versus those delivered by midwives. And the difference in mortality rates was something like 16% versus 7%, I should say. Well, one day he observed one of his colleagues was conducting an autopsy on a cadaver with medical students. He cut his finger and he developed symptoms very similar to childbed fever and subsequently died. And he deduced that maybe it was the fact that medical students and obstetricians were working on these cadavers, doing autopsies, coming in contact with some putrid materials from these cadavers, whereas midwives were not. So that might explain the discrepancy. So what he did is he introduced hand washing, specifically chlorinated lime water here, for all medical students, etc., before attending to women who were in childbirth. And of course, the incidence of childbed fever decreased significantly. Now, this is critical to keep in mind that this was the mid-1800s, and this was prior to germ theory. So this was really revolutionary in terms of thinking by Semmelweis for introducing hand washing. And we know today that hand washing is one of those critical components of infection control, both in clinical settings and in community settings for preventing the spread of infectious diseases. So I mentioned some different types of mortality rates, so I'm just going to show you the calculation for two examples. And here we see the infant mortality rate calculation for a First Nations community in northern Labrador, who reported 12 infant deaths per 10,000 live births in 2017. And you want to here calculate the infant mortality rate for this community per 1,000 live births. So we see the formula: infant mortality rates, number of infant deaths less than 1 year of age, divided by the total number of live births during the same year times 1,000. We want it per 1,000 live births, of course. So we plug in our numbers. 12 over 10,000 times 1,000 equals 1.2 per 100,000 live births per year. Here's another one, very similar. It's the case-specific mortality rate. This particular example involves a community located in sub-Saharan Africa. There were 500 individuals diagnosed with HIV/AIDS in 2017, of whom 17 died within 1 year of this initial diagnosis. What was the cause-specific mortality rate? We plug in the formula again, and over here the numbers work out to 17 over 500 times 100 for percentage, so we have 3.4% in this particular case. Okay, here we see an example for the predicted 5-year survival rates for breast cancer based on the stage that is actually diagnosed. And cancer is actually staged from 0 to stage 4. So there's 5 stages. And many students get confused because they forget that stage 0 is actually a stage. So stage 0, the carcinoma is in situ or is in an early form. Stage 1 is localized. Stage 2, it's locally advanced. Stage 3, it's late locally advanced. And of course, stage 4, it has metastasized. In other words, it has spread to other areas or to other organs. So we can see in the first 2 stages, stage 0 and 1, survival rate for 5 years for women is quite good. It's very high, 198% respectively. And as we increase, and not so bad for stage 2 as well, at 88%. However, when we jump to stage 3 and 4, survival rates for 5-year survival rates decrease substantially. Disease frequency. Well, this is the most basic measure of a disease frequency. Consists of simple counts of an individual's or cases that have the disease, health condition, or altered state of health. Measures of disease here fall into 2 broad categories for disease frequency: prevalence and incidence, and we'll examine both of these in more details in the subsequent slides. So let's begin with prevalence. So prevalence is defined as the proportion or percentage, if you wish, of individuals in a given population who have the disease or altered states of health at a given point in time. Remember that time element in epidemiology is so critical, person, place, and time, as we talked about in first part of this lecture series. And it also provides an estimate of the probability or risk that an individual will be ill at a stated point in time. So we know, for example, that the prevalence of various non-communicable diseases are increasing globally due to aging population trends. So here we see a senior taking her blood pressure. Of course, hypertension has been linked to development of kidney failure, stroke, heart disease, etc. So prevalence, here is the formula. It involves the number of existing cases divided by the total population, and again at a specific defined point in time. And here I have an example of how to actually calculate that. So let's say, for example, during the month of July, there is our specific time period, a total of 14 workers in a steel mill in Hamilton, Ontario, Canada, were found to have DM or diabetes mellitus, and the steel mill had a total of 2,300 workers total. And you want to calculate the prevalence rate of diabetes for the month of April per 1,000 workers. So we have 14 over 2,300. 2,300 is the total number of workers, times 1,000, right? Equals 6.09 per 1,000 workers. Here's another example, prevalence example in the published literature. Prevalence of attempted suicide and suicidal ideation were examined with a survey of 99 Inuit, age 14 to 25 years, residing in a community in northern Quebec, Canada. Here, the researchers reported a total of 34% of respondents having a previous suicide attempt, and 20% had attempted suicide more than once. Indeed, we know that Indigenous populations, First Nations, Inuit, and Métis in Canada face many mental health challenges. What is incidence? Quantifies the number of new events or cases of a disease or condition that develops in a population of individuals at risk during a specified time period. And it provides a measure which determines the rate of change from a non-disease state to a disease state among persons at risk, and also reflects new cases of the disease or condition for a specified time period. There are two major types of incident measures. We have CI, which is the cumulative incidence, and the IR or ID, which are abbreviations for the incident rate or incident density here. Cumulative index, defined as the proportion of people who become diseased during a specified time period, and provides an estimate of the probability or risk that an individual will develop a disease or condition during this specified time period. So the relevant time period must be clearly specified when reporting the CI, obviously. Incident rate or incident density determines the impact of exposure in a defined population and is a measure of the instantaneous rate of development of a disease or condition in a population. It is also important to note that the ID as a measure of incidence should in theory only include those subjects who are regarded at risk of developing the disease or condition. Hence, individuals who are already have the disease or condition or cannot develop the disease, such as some age factors, removal of the target organ, immunization against the disease, should obviously be excluded here. Here we see the IR ID calculation example. So the number of new cases of the disease or condition during a specified time period. And that is simply divided by the total person minus the time of observation. So here we have an incident rate calculation example. During the month of January, a total of 4 clients were diagnosed with mumps in a small rural community of 2,400 in northern Manitoba, Canada. What was the incident rate for mumps for the month of January per 1,000 residents? So ID, here we have 4 clients divided by 2,400. That's the total number in that particular community, times 1,000 residents equals 1.67 per 1,000 residents. Here we see the typical setup. This is a 2x2 table for the organization of cumulative incidence or prevalence data. And we see all the various variables. Total number exposed is A plus B, total number unexposed, C plus D, and so forth. This is how we typically set it up for epidemiological investigations. And of course, exposure is yes or no. Do they have the disease or health condition? Yes or no. This is my a bathtub analogy. It's used quite a bit in epidemiology. This is a drawing that I did. So the water inside the bathtub represents the total population under investigation. So think of the water as your total population. There you see a tap on the left-hand side of your screen that refers to incidence. So that means new water, if you want coming into your bathtub or into your population there. So of course, incidence represents new cases. Okay. Prevalence consists of existing cases and obviously new cases as well, because prevalence is also affected by incidence coming in. You can have recovery, of course, showing there with the water evaporating, or you can have a reoccurrence, such as in the case of a reinfection. And in the bottom of the bathtub, that's water leaking out of that total population, if you wish, is death or mortality, if you wish, happening. So that's a good way to remember some of these keywords and what they mean. This is the way that I remembered it when I was a student. What are attack rates? This is another common measure that we see in public health reports. So when new cases of a disease or conditions occur rapidly over a relatively short period of time, for example, with food poisoning attributed to improper storage of refrigerated meats, as shown in this photo here that I took, in a well-defined population, the incident rate in this particular case is referred to as an attack rate. Okay. This is one photo that I snapped, and I reported it to public health. The public health inspector came out promptly and issued various penalties and warnings for this grocery store. You cannot safely store meat above that refrigerator line. There's a line in that refrigerated unit. In this case, it's a red line. And of course, they were stacking meat significantly higher, about 6-7 inches higher than what they should have been. This is a violation of public health safety standards. So here's an attack rate calculation. Number of new cases during a specified period, number of people at risk during the same period times 1,000 for a percentage. And we can calculate primary and secondary attack rates. Okay, so primary attack rates, let's say you had 100 individuals and we plug in our formula, comes out to 33%. What was the secondary attack rate? Always remember to reduce the number of people at risk by the number of people who are no longer at risk during that specified time period, right? So we can also calculate that. 150 over 200 times 100 equals 75%. Let's look at various measures of association that are also used in epidemiological investigations as well. Well, measures of association are defined as statistical measures used to investigate the degree of dependence between two or more events or variables. And events are regarded as statistically associated when they occur more frequently together than they could be when we account for chance alone. It is critical to keep in mind that the presence of a statistical association does not alone imply causality here. Measures of association continued. Two of the most commonly reported measures are relative risk and attributable risk. These measures indicate the degree of increased risk and or frequency that one group will develop a disease or health condition in comparison to another group. The relative risk or risk ratio, abbreviated RR, are defined as the ratio between the rates in the exposed and unexposed groups. So RR comparison provides information about the strength of the relationship between the exposure and the disease or health condition, and is most often employed in etiological investigations. Most epidemiologists and healthcare researchers prefer to use the RR measure for comparisons in etiological investigations because it is anchored by a baseline value here. The RR calculation example. So let's say we have conducted a prospective cohort study which examined the relationship between exposure to the fire retardant asbestos as an occupational risk in firefighters and the subsequent development of mesothelioma, which is a form of lung cancer. So here we have a cohort of 1,000 firefighters were followed, and the distribution of melanoma was also determined. Of course, here we see the 2x2 table, plus negative for asbestos and development of mesothelioma. The incident rate among firefighters exposed to asbestos calculated by A over A plus B, or 225 over 300. And the incident rate among firefighters not exposed to asbestos is determined by the formula C plus D, which equals 75 over 700. Hence, as noted in the previous 2x2 table above, 225 out of 300 firefighters exposed to asbestos were eventually diagnosed with mesothelioma, in comparison to 75 of the 700 firefighters who were not exposed to asbestos at work. Now you want to determine the relative risk among firefighters exposed to this occupational hazard of asbestos in this cohort study. So the relative risk, we look at the incident rate among the various groups, risk and not at risk. The relative risk, we plug in our numbers here as shown here, 225 divided by 225 plus 75 over 75, bracket 75 plus 625, and we end up with 7. So in conclusion, we can say in comparison to firefighters who were not exposed to asbestos, which is, of course, an occupational hazard for the development of mesothelioma, exposed firefighters were 7 times more likely to develop mesothelioma based upon this prospective cohort study. Attributable risk or risk difference. Attributable risk or risk difference is defined as a measure of association that provides information about the effect of the absolute effect of the exposure or the excess risk of disease or health condition in those exposed compared to those who were unexposed. And this measure is expressed by the number of cases of disease or health condition attributable to the exposure of interest. And here we see the formula here. The last one I want to talk about is odds ratios. And they are typically conducted for case control studies and provides a measure of the strength of association between exposure and the disease or health condition under investigation. So a case control study often precedes a cohort study as an important initial attempt to identify the risk factors for a particular disease, health condition, or event. And in this case, I have a photo of a gentleman who suffered from a traumatic head injury that I shot. The OR calculation, AC divided by B over D. Of course, it's AD over BC is the formula for the odds ratios. And we see the setup here for an odds ratio example between smoking as your risk factor and developing stroke. So we have a smoker and a non-smoker. Here's your 2x2 table. Development of a stroke or no stroke. And of course, the odds ratio is determined by A times D, B times C. And it works out to be 2.25. In this case, it's high. We know that odds ratios of 1 is interpreted as no association between exposure and discs, and the disease, I should say. An odds ratio greater than 1 indicates a positive association, and odds ratio of less than 1 indicates a negative or inverse association, if you wish. Here's an additional suggested reading. It's Chapter 6, Epidemiology, Essential Concepts for Public Health. Well, that's all, folks. Thank you for listening to this lecture, part 1 and 2 related to epidemiology and its role in public health. And I hope that you enjoyed it and listened to other lectures in this series related to the art and science of public health. Cheers.